Hello, I'm Robert McMullen. I'm a psychiatrist, and I'm going to talk about social anxiety disorder or social phobia and some aspects of its treatment with TMS and medication. I went to Georgetown Medical School and Columbia for psychiatry residency, and I've been practicing mainly psychopharmacology for over 35 years and added TMS about 8 years ago because I needed a new modality when we got stuck on getting someone better. This social anxiety disorder is much more common than people think. It affects maybe 5% of the population to some degree. And some people it's more severe, of course, than in others. In people who have a relatively mild to moderate case of social anxiety disorder, I'll call it SAD, they have a pretty high rate of getting into trouble with alcohol. But those patients with SAD who have a severe case of SAD, they don't get in trouble with alcohol. The reason seems to be that if you just have a mild to moderate case and it's torture to go out and be around people, then if you have a few drinks of alcohol, you'll go. But people with severe cases, they're definitely not going to go under any circumstances. This is a very painful condition, and people feel on edge all the time, usually when they're around new people, but even sometimes in front of their own family. If you give them a surprise birthday party, sometimes they're very unhappy about it because now they're going to be the center of attention for an hour or two, and there's just this worry that they're going to say something wrong or do something wrong or embarrass themselves, or they just don't want to be the center of attention. I had a fellow once who had been a pro basketball player. He was I can't remember whether he was 7'4" or 7'6", and he came to me because he had a severe depression, and but he also had this social phobia, and he said that he's probably the only guy in the NBA who, when he was on the bench, would sit there and pray that the coach would not send him out there because it was very uncomfortable to be the center of attention in front of 70,000 people. His father, on the other hand, could give lectures and talks and at sports events and for young sports-minded people, but he couldn't possibly do that. And if you're really uncomfortable when people are looking at you, think what it's like if you're 7'6" and you're walking down the street. Everybody's looking at you. Yeah, he and I both had to laugh about it. And he felt like such a freak, and he said, that this was bothering him so much. I said, well, how much does it bother your friends? Do they feel like they're freaks because they're this tall? And he hadn't really thought about it like that. And in any case, it was an extremely uncomfortable condition for him. And luckily, he had a skill so that he became somewhat successful despite it. With many other people, this is a fatal illness as far as their career, because some of them cannot interview. They just completely fall apart in an interview. They'll look terrible, even though they're the nicest people in the world, and when you work with them, they do really well, and maybe after they get to know you, they can do well. But to interview with a stranger, it's just, I've had a number of patients that had this. One of them recently, he's nearing retirement, and a new boss came in and cleaned house, and then here he had to go and try to find a job when he's almost to retirement age. It was torture because he would almost vomit. It was just so much anxiety and willpower to get through it, but also the anxiety that he could literally vomit right in front of the person who was interviewing him. That's how much anxiety he had. And I knew this fellow a long time. I hadn't seen him in 10 years because he was somewhere else, but I had sort of forgotten about the social anxiety part because it doesn't come up between him and I. But it was a major thing in his life. I have another patient who lost his job in the 2008 recession, and it turned out he just didn't have that many connections, and he had a very good engineering job, and a company would repeatedly hire him, but they really scaled back or went under with the recession. And he really attributes a lot of his inability to find another job, not only to the fact that he was over 50, but to the fact that he had this social anxiety. So it was very difficult for him to interview or to make a network of friends. And a lot of times when the men get married that have this, it's the woman that asks them out. I had one very muscular, incredibly good-looking construction worker, and another fellow I knew who was a steel worker, and he looked like a steel worker, massive, big guy who loved to get up on these steel beams and hammer things together, and another fellow who graduated from a top law school. And with all of these people, I said, well, how did you ever get married? And in each case, the woman asked them out. And luckily, they were nice women. So anyway, it's a problem. And the medicine doesn't help that wonderfully with this. Benzodiazepines are sometimes necessary. They certainly help calm things down. And it's certainly helpful to take propranolol before interviews or before anything at work that's going to be overly stimulating. Propranolol is an old blood pressure medicine that blocks the heart from racing, and it also blocks the fight or flight response, so that it cuts down on the sweating and all the other things that happen in the fight or flight response, and then that in turn helps really reduce this type of anxiety. It's something that I'm sure that cognitive behavioral therapy might help some. I'm not specifically familiar with that, but I do know that it helps if you force yourself to do what you're anxious about doing. And then the second thing to do is whatever you have a fear of doing, you do it. And the third thing you do is whatever you're most fearful of, you do it, despite your... And if you do that, that will help out with this. But it's hard. It's a very tough thing to do. I'm not sure how TMS is going to impact with this. I have a feeling it's going to be very helpful once we figure it all out. and once we find the right place to treat and so on. I have one fellow, a Hasidic fellow that I've been working with. He has some mood swings and that we've had to control, and it's really given him some trouble. And I didn't even really realize he had this social phobia so much. He has a shul, he has payas and tzitzis, and he even dresses all in black and with the hat. And then in his community, everybody's close, everybody knows one another. He goes to the local shul to pray, daven, and the people there are people he's known forever, that he went to yeshiva with. And but it turns out he never schmoozes. He doesn't sit and talk with people and make friends and talk about personal things. And his life has really been somewhat miserable because of this social anxiety. Now, I never notice it much or think about it because he and I know each other really well, and he's pretty comfortable talking with me. And then he had a period where he got very depressed. He had a pretty bad depression that was persisting, and he really wanted to do this TMS. So I said, okay, so we did it. And when people are a little bipolar, you want to do a right-sided inhibitory treatment here so that you don't cause them to cycle. And it works just as well for depression in any case. And it also happens to directly help anxiety. And we gave him quite a few treatments, I think 30 or 40. And then he said, my social phobia is gone. I said, what? And it was. It just virtually disappeared with the treatment. And now it's 2 or 3 years later, and it's a little bit there, but it's minimized. So this anti-anxiety treatment we gave him really worked. There's also now a few other places to treat. You can treat depression up in the medial prefrontal cortex. You can treat depression by inhibiting over the right orbital frontal cortex. So this is dorsolateral. This is called orbital frontal cortex. Both would get inhibitory treatments for helping depression. And now another place was just published where they did an inhibitory, which is a quieting down treatment, which sounds right for anxiety, in the right parietal area. And in this study, they treated people for anxiety and insomnia. These people weren't particularly depressed, so they were treating specifically for anxiety and insomnia, and they had statistically good benefit of the real treatment versus the sham treatment. So all of that's very promising, because that means that we may gradually find the places that we can do this to help out chronic social anxiety. And also, we'll just have to find out, like, if it's going to take a lot of extra treatments or not. One unusual case I had is this young lady. I started treating her when she was 20. And she had some anoxia, lack of oxygen at birth, which gave her some learning disabilities and contributed somehow to her having a lot of anxiety and some mild depression, and an eating disorder. So she was really quite obsessed about food. And it was really hard to figure out all the things that were going wrong with her. And giving medicine and therapy didn't really help out that much, you know. So when she was 22 years later, when she was 42, she really wasn't much different than when I met her at 20. I gave her some Prozac type medicine. I gave her some anti-anxiety medicine like clonazepam, and I could take the edge off of things, but it never had anything near, didn't come anywhere near making her functional and feel okay. She was just unhappily anxious and nervous and worried all the time. And she probably qualified for generalized anxiety disorder as well. And I believe she had panic attacks. I'd have to look it all up. She had so many things. But anyway, at age 42, 20 is when she came to me. And then I treated her for 22 years. And then at 42, when she still was about the same as she was at 20, she had a really severe depression, which she never had before. It was a severe depression. So then, a family member had done terrific for lifelong depression with the TMS. So she came in without a problem, and we treated her, and it was only 14 treatments. And then the depression was gone. And then the next year, she relapsed a little bit, a few times. So then she got another 4 to 6 treatments. I think maybe she got a total of 20 treatments stretched out over a year or so. And then a few weeks ago, I sat down with her and I was going through the problem list and I realized her anxiety disorder is gone. She has no depression at all. Everything that she had a problem with is not there. And then she had this eating disorder where she had to keep her weight at 115. And she'd been obsessed with that for years, and family members were worried about her health, whether she wasn't going to die from this eating disorder. And I said, well, what about the eating disorder? And she says, well, I weigh 145 pounds, and I'm fine with that. I could have fainted. And every problem she had went away. And I talked with her parents, who I know really well, and for other reasons, and they said yes, that they're astounded as well, and they said it had to be from the TMS, because it's the only thing that changed, and it was astounding that it was only 14 treatments. Actually, it was a few more, but the treatments were 4 years ago, and 4 or 5 years ago, and they said that she got a lot better then. The depression went away, some things improved, but then over the next 4 years, she would start improving. Something would improve, and then a problem would be gone, and she'd be on another plateau, and then something else would improve, until all of these problems are gone. It's really an astonishing story. And I think there may be a few like this. Jonathan Downer said, who's the greatest researcher in TMS, he's in Toronto, Canada. He said once that if you notice, he says, you will see that often the people we have the most benefit with are sometimes the people that have the most problems, the most illness, the people we least think would do really well, not only do really well, but everything gets better. This happened with a patient that I published about who had rapid cycling agitated depressions, no real euphorias, and severe OCD with just massive guilt and just massive anxiety and torture and everything that had been going on for 25 years. It started when she was in second or third grade, and she was 29 when we treated her, and all of her problems went away. Took 70 sessions and about 5 treatments a session, so she had about 300 treatments, but it was astonishing that everything went away. And now I have another young lady I've been treating quite a few years, and I just talked to her mother, and we're also astonished that she has been so severely depressed, so dysfunctional, so anxious about everything, and with many serious suicide attempts, the kind of patient no psychiatrist wants to see. And there really was very little one could do with insight-oriented therapy. And I put her on a dose of clozapine, which did change things a lot, that improved things a lot, but it's been in the last couple of years that she's sort of just becoming more and more normal. No suicidal ideation, no self-harm, and functioning really well in school and research, and she's received about 100 TMS treatments over the last few years, and every time she comes in, I'm now telling her, you have to get a treatment. Just get one when you come in, because I think that this is gradually making a change. I never expected, with any of these 3 people I just mentioned, I never would have expected them to do as well as they did.